Hello, this is the Kratom Sobriety Podcast. My name is Charlie. We're at episode 133. Today we have a special episode where we're doing a roundup from the people tackling the issue of Kratom addiction. In the last 6 months, there was a treasure trove of other podcasters digging into these issues, and we poured through about 10 hours of tape and distilled it into about 70 minutes of the best, most informative bites, and we're going to share them here. You're going to hear from some familiar voices and names, Libby and Decima, and some other folks that were guests before, including Dr. Casey Grover and Noah. So please check out these podcasters, give them a like, a 5-star ranking for covering these issues, and we'll be back on Sunday with an interview with a quitter. And until next time, keep it Kratom free.
A few weeks ago, I talked to a search engine listener with a question. Chris had written to us about an experience he'd had with addiction. Addiction to a kind of drug that neither of us was sure you were even supposed to call a drug. It was hard to know how to talk about any of this. But I'd wanted to speak to him because the substance in question, and Chris's questions about it, in the past year, a bunch of my friends had taken me aside privately with similar questions. So you wrote us an email, and all the emails go to my phone and I read them all, but yours I read quicker than most because it had the word, it's pronounced kratom, right?
I really don't know. I've heard kratom with a long A.
You hear kratom. You've heard more kratom than kratom.
Yeah.
All right, let's proceed with kratom. So Chris in rehab was talking about how he was struggling to quit cannabis. And this other guy mentioned that he had also had a bit of a problem with something called kratom.
And at that point, I didn't even know what that was. My awareness of it was basically like a sign lit up on the window of the vape shop, which around here is the main place where you see it. And the vape shops are as common as check cashing places. They're just everywhere. So my addict brain was like, on the one hand, oh, this is something to really avoid. And then on the other hand, something that I didn't really know about that was really obviously easy to get, kind of piqued the curiosity there.
Yeah.
So did well with rehab and got back to work and was keeping clean off everything for about a month. Then started back up with smoking pot. And around that same time, I popped into the vape shop to get tobacco or weed-related stuff and was like, I'm going to try some of these Kratoms.
If Chris was trying to figure out what to expect from kratom, the way it's sold makes that mission a little confusing. He saw it in a vape shop. It's also sold at convenience stores and gas stations. There's often a picture of kratom on the packaging, a gray-green herb, which suggests it's natural. It's also often sold near cannabis products, suggesting it's mood-altering, but maybe not that strong. Sometimes it's behind the counter. Sometimes it's in the aisles with the candy. If Chris was wondering, will this work? Is it safe? Is it more like a medicine or a drug? The cultural signaling around it was just messy. But he wanted to try it, so he bought some.
So the way that I got it initially was in capsules, but it looks like an herb powder. And the capsules, they could be vitamin pills, or you can also get just like a powder or liquid form of it. And it's just really nasty, very bitter.
What did the high of it feel like?
It's not very pervasive. It doesn't get all over you, like even like smoking cannabis or anything. But main things that I noticed, pain completely gone. All the like body aches and all that stuff, just not there at all. Nervous eating, all kinds of things that I deal with all the time were greatly lessened. But honestly, as soon as those beneficial things started showing up, it came right along with it where I noticed if I didn't take them for a while, I just felt crappy.
And what did crappy feel like?
Like emotionally low, really pissy, just like in a really bad mood. And then my pain would come back too.
Kratom had briskly gone from a substance Chris was curious about to a substance he felt was giving him a nice high to a substance he was pretty sure was leaving him in withdrawal. So now he needed to make sure he was taking Kratom often enough to stay ahead of that withdrawal feeling. So his consumption went up, which made him feel ashamed. Chris was having deeper withdrawal symptoms. He now had trouble sleeping without the pills. And when he would fall asleep,
I would wake up midway through the night, heavy night sweats, and have to take more of the pills before I could fall back to sleep again. In the morning, I would take them into the bathroom with me and take 3 or 4 every couple hours at work.
It sounds a lot like an opioid.
Yeah.
I haven't taken opioids recreationally, but I just was recovering from a surgery, and so I've been on them recently.
Yeah. I'm the same way. I've taken them for an injury, but never recreationally.
Were you surprised to find yourself in such deep water with something that you could buy at a vape shop?
Absolutely. And the whole time I was really struggling with it because it was like I knew I was hooked on it and that I was having these adverse effects. And at the same time, I was like, it can't be that big of a deal. I'm struggling with something that everybody else would deal with very easily because it's just this casual vape store stuff. I feel embarrassed to try to get help about it. This is not like alcohol where everybody understands what a big problem it can be. And
were you telling anybody that you were using it?
Nope.
It's such a lonely experience. I feel like when people have issues with substances, you're in a big community of people who have those issues. But when you're having it with something that's like more relatively unknown, it sounds like it's just like even harder to chart.
Yeah, I mean, I went into detox for this eventually at the same center that I've been to rehab for alcohol. And honestly, mostly found there that people knew just as little about it as anywhere.
Oh, really?
Yep.
When you say people, do you mean like other patients? Do you mean practitioners? Like everybody was just like, I don't know?
Everybody, yeah. Practitioners, the psychiatrist in charge of the place was doing research on it.
That's such a crazy feeling to walk in and they're like, I'm going to need to Google this one.
Yeah.
It's nuts, man.
It is. And so I was having really serious withdrawal symptoms, and I would describe those to the doctor or the intake people or whatnot. And they were like, that sounds just like opioids. I had these body aches and joint pain and extreme anxiety and crawling skin. And yeah, it was at the same time hard to wrap my head around that it was even a real problem or that anybody was going to acknowledge it. And then also in my face that it was definitely a big problem. So
it's like you're trying to figure out if you're in the kiddie pool or drowning in the ocean. And like when you're having opiate style withdrawals at a detox center, you kind of have your answer.
Yeah.
How are you now?
I'm good. It's been like 6 months since I've taken any of those now.
Congratulations.
Thanks. I feel much healthier and happier.
And for you as a question, just like essentially like, what was that? What was that drug? Is it an opioid?
Yeah. I'm curious about specifically what is it? How's it made? How does it get here? And I would like to know, are other people struggling with it? Are there government or law enforcement or regulatory agencies that are working on it?
All right, let me find out what we can learn.
Okay.
Hello, and welcome to another episode of Dopey, the podcast on drugs, addiction, and dumb shit. And my name is Dave. I'm with Jana Wu, who is, what do you do?
I'm a licensed clinical social worker and a licensed alcohol and drug counselor. I'm the director of cultural integration at Mountainside Treatment Center. Tonight at 7 p.m., I have my Kratom group that I started June of, not this past June, but the June prior, so June 2023. But I have a Kratom support group, and I think I've only missed one. I even have done it from like Costa Rica, Seattle, like family vacations, I will log on because I love that community and that I really love that group. I wanted to say it's like my baby, but it's not that. Like I just really do enjoy.
No, and that Kratom Zoom is a big Kratom Zoom, and a bunch of the dopey Kratom folk came out of your Zoom.
Yeah, a lot of people hit a lot of the same meetings because there are meetings now every day, which is amazing. There's a lot of good resources, but there are Kratom meetings every day.
Let's start there. What is Kratom or Kratom?
Kratom has been used for centuries in Southeast Asia. So very warm, tropical-like climates. It's been used typically a lot, often by day laborers, like people that were working hard all day long, maybe rice paddies, working for, again, long periods of time. So you could chew the kratom leaves and it acts as like a pain reliever and also a mild stimulant. So you can get through your work and work hard. And it also is boiled into teas, dried, boiled into tea. So it's been used forever in Indonesia, Thailand, throughout the world, and throughout the West, a lot of places too.
So it's kind of like an Eastern version of how they ate the coca leaves in South America or brewed tea before they turned it into cocaine.
Yeah, but yes. And I think there's just this interesting aspect with tea, in general, like how, when we look at teas and all the health benefits of teas and how culturally important tea is to so many places, it's hard to pathologize it. So when you talk about that, you're taking like a tea all day to help you get through, it sounds like a really good option of all the options we have.
But it isn't?
So I think like anything in the world, it's not binary. There are risks, and I truly believe there are benefits for some people. I think for some people that have used it for harm reduction from other substances or alcohol, they have found it to be very helpful. Also, I have spoken to and understand a lot of veterans that have stated it's been very helpful for PTSD. A lot of people say it helps depression. I don't think I have the right to argue with anyone's experience. If that's what someone says has helped them, that is their experience and that is what they know to be true. Other hand, I've really seen some pretty extreme detrimental effects for a lot of people. I've seen how it can ravish families the way other substances can do. I see how it can create massive isolation, how it can really challenge the physical body. I think constipation, hair loss, skin discoloration, seizures, like all sorts of things. Yeah, there's a lot of different side effects.
Does any other drug cause hair loss?
Probably, but I can't think of one off the top of my head. And that's, again, not for everybody, but these are, again, some of the more problematic aspects that some of the people in my life have experienced that I really wanted to dig deeper in and see what's going on. And I think it, again, comes back to nothing's all good or all evil. And the fact is with Kratom, it's unregulated and it's really prevalently used. Some industry, and when I say industry, like Kratom lobbyists, supporters, say that several million people are using Kratom daily. Other people estimate that less than 1 million people are using it daily. Other research. It's really hard to quantify, though, because some people don't even recognize it as like a substance of concern and see it just as a supplement. So they wouldn't even report it to their doctor or their substance abuse therapist or their primary care doctor or anything. But I think that's actually changing now. I think anyone that starts to look into it even a little bit can see how much is out there as far as like Reddit, the subreddits, and a lot of other resources online that are starting to really speak up about some of the more problematic aspects. And then also that talk about a lot of the benefits. I think whatever the case, like we were really well aware that we are a culture that's really addicted to having like our MU receptors filled and really addicted to that.
What's an MU receptor?
That's like where the opioids plug into. So it's like that feeling. And I think as a culture, we really like that feeling. So here's something that can give us that feeling. That's, again, being like when something being, I don't want to say cultivated, but so curated to give you the most distinct high. This is very much created to have a very distinct effect that's very similar to opioids.
I worry about this because one of my concerns is like people who do heroin and now do fentanyl are like scared of dying, so they do Kratom. It seems like a very quick transition for somebody. Rather than to get into recovery, they're like, I don't want to get killed from fentanyl, so I'm going to do Kratom.
I think we could talk more about some of the negative consequences for people that have a history of addiction and a history of mental health or behavioral health disorders. So just like you're saying, it is a lot of people state it's really for them a harm reduction, save them from alcohol, save them from fentanyl. That's been their experience. That's incredible. And sometimes even those that it saved them from something, it has very addictive properties for many people that struggle with addiction. Not all addicts will identify that way, but many people that have struggled historically with addiction, have mental health or behavioral health disorders, can get what is not in the DSM now, but a kratom use disorder. It's not actually even officially diagnosable yet, but they can have all those criteria that we have, like the 11 criteria we have, like for alcohol use disorder, opiate use disorder. We can apply those to kratom use disorder. And I do believe, and I'm hoping that it will be in the new DSM, a kratom use disorder, because I do believe many people do have that. We can be addicted to a lot of things, food, sex, all sorts of things. So I think even something really good we can be addicted to, kratom.
Totally.
And it can, again, have really devastating consequences for people.
And it doesn't sound like there's a lot of overdose, though.
There are reports of overdose, and there are significant reports of seizures. So
Seizures.
I think there are less reports of respiratory distress and more of, again, the seizures. There's some psychosis, some other negative effects and unpleasant effects. Again, the GI effects can be really significant, like
that would
massive
be gastrointestinal.
Yes, like massive constipation. A lot of people, what's interesting about kratom, it's like people take it in the beginning sometimes for like weight loss. And then in the end, it's, again, more GI effects of like really painful, like stomach discomfort, like significantly, like having to go to the ER and just being in massive pain. Some people take it for social anxiety. And then for some people, again, only, it's like they can't leave the house then without it. And the social anxiety is spiked and so much worse unless they're dosing. And like a lot of other drugs, they've built up a tolerance. You got to dose more. And you reach a point where you're not getting the same effect anymore that you originally took it for. And you're not getting that relief that you took it for. Like one important thing that's so important, I think, with all these conversations is recognizing why people are using kratom. Because a lot of people have different reasons. Sometimes it's for pain, arthritis. Sometimes it's, again, for mental health, PTSD, depression, anxiety. Sometimes it is like busy moms that are just like, I need more energy. I need more energy to do the soccer games, do the homework, get through this day, get through my job and my kids. There's a myriad of reasons, not just the arthritic pain, but other types of physical pain, back pain. So I think it's so important to ask people and figure out what they're using it for. Because it's not just often to get off of other substances, but it can be, again, so many different factors. So in some ways, I see how it's touted as like this miracle drug, because look at that long list of things it can help with.
But it sounds exactly the same as every other drug.
Yeah.
Like every drug once was that, and then it became this horrible scourge. When I started taking heroin, it definitely helped me with anxiety. It gave me energy in weird places. It relaxed me. And then before I knew it, I was just at home shooting heroin, not feeling I was still getting high, thank God, until the tolerance became too bad. So it's what you're describing to me sounds like basically every drug.
But wrapped up in something healthy like a tea that's used in Asia. Everyone loves everything Asian. It's like this is wrapped up, again, too, in a botanical, a supplement. So
opium is Asian.
Yes, I know.
Heroin is got Asiatic roots.
Yes.
So not everything, a lot of Asian stuff is holistic and good, but not everything.
They bring up the cost too, because that's often what I see brings people into treatment, is that they're spending thousands of dollars a month on. There are other brands too that are similar, but like extracts are pretty small. You can hide them in your car and it doesn't smell like alcohol.
They come up on drug tests?
Good question. So it does. For certain companies, you have to do what's called like an add-on or specify, basically, I want mitragynine like tested on this person's sample. And we do that often because a lot of people identify that they're using it. We'll say, okay, like, how's that working for you? Is this something you want to decrease? Some people do come in for kratom only. So then, of course, we would test for that frequently to help them. And also just like for a lot of people, it's very affirming when they get several drug tests that are negative. But yeah, you can test for it. But a lot, it's commonly like an add-on, and then it doesn't come up yet on rapids. I wouldn't be surprised someday, again, if it's diagnosable, if we have more treatment options, because right now there's actually no solid evidence-based treatment protocol. There's a lot of things that people are doing, providers are doing that's working, and there are a lot of kratom detoxes like throughout the nation that are doing amazing work. But I think things will get more standardized, which has its pluses and its minuses if it does get more regulated. Yeah, it doesn't test right now on any rapid that I know of. And so it's a problem for sober homes if they don't want people using it because
sober homes need to test for it. That seems like the perfect place to be testing for it.
That seems like a lot of where people can use it too, because it's not tested for. And again, it doesn't smell, easily accessible. You can go out and get it very easily at a bodega, at a gas station, at a smoke shop.
Like, why do people compare kava and kratom so much?
I don't want to say, they're very, to me, very different, but they are so interwoven for a lot of people in their mind. I think partially when we talk about drinks like that, elixirs that were made with kratom kava, so they came together like that. There are a lot of kratom kava bars, particularly in Florida, a few other places, I think tend to be more south. And I don't know, this is again, not to advertise, but like some of them are really, really nice. Like they're lovely, lit, lots of plants, cats, like you could bring your kids. It's like the alternative to a bar. But again, if this is like your substance of like your kryptonite, it's not helpful.
Have you done kratom and kratom bars?
Have I done kratom and kratom bars?
You have?
No, I have not done kratom and kratom bars. No, I think again, you can get tea in kratom bars too, just like normal herbal tea.
Do people bug out in kratom bars?
No, not the ones that I've been to. They've been very
tranquil.
Yeah, I was going to say peaceful. And
that's what they said about opium dens too.
Yeah.
Very peaceful places.
But I am a fan of, in general, being transparent and like talking to people about what they get out of it, to like out of a place of curiosity. Like, why are you here? Why is this helpful? How has this helped your life? And I'm willing to share too, like my experience. This is where I think it's been really challenging for a lot of people, like really challenging, really hard to get off of, very uncomfortable. And I think that's, again, this very deceptive part of it, where something that's so wrapped up in like a more wholesome package that it is so hard to get off.
The innocuousness of it.
Yeah.
So kratom or heroin, like what's harder to kick?
A lot of people do say actually that they have kicked heroin and that kratom's harder. And I don't know, again, if it is that like deceptiveness or if it's, again, I think for some people I see like a lot of people really struggle at like, the 30 days, the 90 days. That's very hard. It has its hooks in you really similarly, I think, for some people, again.
And what do we do to treat it?
Okay, so there are a lot of options, like I mentioned, for kratom detoxes, like formal kratom detoxes where you could go and have a medical detox. This person that didn't give their name talked about like a taper. There's a lot of tapers that are online where people go through step by step. I'm not going to advocate for one thing or another, but for kratom detox, what we would typically do like at Mountainside, we do it. Our staff is pretty knowledgeable about kratom. We would probably start with like comfort meds, things to make people feel comfortable to get through the withdrawals. Some people do choose to go on buprenorphine. Some people are pretty adamant that they don't want to take that path because some people get on kratom, as we were talking about, to get off of Suboxone. But it can be a very safe option for people, especially if someone's pregnant.
Easier to get off buprenorphine or kratom?
That, again, is debatable, I think, based on people's personal experiences. I think we're all wired differently. And I think for some people, it's easier to get off of buprenorphine than kratom. And then I've heard definitely the inverse is true.
Everyone says how hard it is to get off methadone and that kicking methadone is so much worse than kicking heroin. And in my experience, I think it was pretty similar. And I was on buprenorphine for very short periods of time, and I thought it was similar too. So I would imagine it's all like where somebody is in their life when they're kicking. Everyone decides this is the worst kick. It sounds like fentanyl, from what I'm hearing, is the worst kick. Somebody else wrote, I have a beef with the demonization of kratom. I take it daily for energy. I buy it in powder form and swallow a teaspoon in a parachute once or twice a day. People can become addicted to anything. Seems to me that is a good form of harm reduction. So it's one man's ceiling is another man's floor. If kratom is working for you and you're not dying on fentanyl, good. And if you're hating kratom and you want to get off of it, you can get off of it.
Welcome to the Addicted Mind podcast. My name is Dwayne Osterland. My guest is Decima Davis, and she is going to talk about her recovery story, but specifically she's going to talk to us about her recovery from Kratom.
Well, first of all, thank you so much for having me on here. I am really passionate about getting the information out there because, like you said, a lot of people aren't familiar with Kratom. You'll hear it pronounced a lot of different ways. I was addicted to Kratom for 9 years. I have 19 months Kratom free as of today. In fact, I'm celebrating 19 months.
Congratulations. That's awesome.
So I actually do have a history of addiction, a long history since, my teen years on into adulthood. It's been a long journey, but to be honest, Kratom was a strange part of that journey because I actually found Kratom in an attempt to find something to help me get off of the drugs like methadone and Suboxone that I was using to come off of opioids and opiates. And I'll be honest, I knew immediately that there was something more to it than just being a plant because it worked. Immediately I didn't need Suboxone anymore. At first, I was really pro Kratom. I was telling a lot of people about it, like this is this wonderful plant alternative to opiates and opioids. It probably wasn't until about 4 years of using Kratom that I finally started realizing that it was a problem because I started having a lot of health problems, side effects, and it was just affecting my personality in all the same ways that it would affect your personality to be strung out on opiates. I was angry all the time. I was losing my hair. I wasn't eating correctly. And I was just like, my hands were numb all the time. I had restless leg syndrome. Eventually, It got to the point where I was waking up in withdrawal every single day. And one thing I do want to say, I want to preface this whole entire interview with the story I'm telling you about my personal experience. There's a lot of people that have the same exact experience. A lot.
Right.
So I'm not unique. I tried to quit so many times, and this is also a very common story. I was able to quit harder substances so much easier. Kratom was so hard for me to quit. I relapsed so many times, and I don't know if it's because it was so easy to get to or if the withdrawal was some of the worst withdrawal I've ever had in my life from anything.
Wow.
Yeah, it was full on cold sweats. Let me tell you, a typical morning for me, I would wake up with cold sweats and restless leg syndrome. And I would wake up an hour before I actually had to be up so I could dose and then lay back down and wait for it to kick in. I started every day like that. And some days I wouldn't make it in time and I would throw my dose back up. So I would take it again, throw up, take it again.
Oh
and
my
that's how I
goodness.
actually ended up overdosing and having seizures.
Oh my gosh. So tell me about that. You got to that point where you got to these seizures. You're trying to keep these doses down. Your body sounds like kind of really reacting to this in a negative way and telling you stop.
Yes. I was losing my hair. My skin was really broken out all the time and would not heal. I feel like it aged me incredibly. Yeah, just like any other drug. It's not good to put in your body every day.
So you had these seizures, and then what did you start to do after that? Like, what happened?
So I never had seizures before in my life, and I really didn't realize that's what was happening at first until I got diagnosed and ended up at the hospital. But within 5 months, I had 3 seizures. Like I said, I had tried to quit many, many times, and it took 3 seizures. It was really scary. I woke up in an ambulance, and I didn't know who I was, where I was. Yeah, very scary.
So when you realize this and you're like, okay, this is bad for me. I'm having seizures. I'm in the hospital. And you started to get help for this. What was your experience in this? Like when you started to say, hey, I'm addicted to this substance over here that's not really known. It's there, but a lot of people don't understand it.
Yeah, I'm glad you asked that because that may have also contributed to why it was so hard for me to quit because there really wasn't. Not only was there not a lot of help and resources and information out there, but there was also a lot of people that would give us a hard time about it. A lot of pro Kratom people that would call us liars. And still to this day, it happens, not as much as it did back then. It's hard to talk about it when you don't trust that people aren't going to judge you and blame you for it. So it was really hard, which is what led me to kind of create that space so that others that are struggling with it had a place to go where people weren't going to ridicule them.
Yeah. So like really dismissed your experience, kind of saying like, what are you making up here? Mm-hmm. This is all right. If someone's out there struggling and they want to get a hold of you, they want to know more about this, throw out the link again.
KratomQuitters.com.
Welcome to the Addiction Medicine Made Easy podcast. Hey there, I'm Dr. Casey Grover, an addiction medicine doctor based on California's Central Coast. Today's episode will be on my experience practicing addiction medicine in a rural area near me. So I prepared a lecture that shared my overall experience, and I highlighted cases that I thought had great learning points around how to treat addiction. Let's dig in. All right. Case number 3, she's a little unique, but this is a young woman who came in to ask for help with Kratom. And the reason I bring up Kratom is a kind of a brewing disaster in the world of addiction medicine. And just to level set, just to make sure we're all on the same page, Kratom is a leaf from a plant that's grown in Southeast Asia that has a number of effects on the body. At low doses, it's a stimulant, and at a higher dose, it acts like an opioid. Most medical providers that you talk to this about have no clue. And so this particular patient mentioned to the staff at County Behavioral Health that she really hadn't found a doctor that knew much about Kratom. And I outed myself as a Kratom geek. I've been on the Kratom Sobriety podcast. I've interviewed some folks in the Kratom industry. I even went to a local smoke shop and bought Kratom. This is a big issue. It's estimated that as many as 20-something million Americans use Kratom, and yet it's an unregulated supplement. There's a huge division in the Kratom community of users as to what the right treatment is. So she was very grateful that I had some experience with Kratom. So when I talked to her, she was predominantly using Kratom for its stimulant-like effect. She was doing it to be more productive. She felt like she needed to get things done. And I actually talked to her, as many of my patients who use stimulants have. She had some ADHD tendencies. She had some trouble in school. She really struggled with math. She had trouble staying productive, and that's where it seemed like Kratom really helped her. So she was dependent on Kratom, and it acts like an opioid. So I put her on some Suboxone, which she did fairly well on. And I actually put her on some Strattera. The generic name for that is atomoxetine, because I thought she might have some underlying ADHD the way she was using Kratom to get its stimulant effects. And she actually felt a lot better. She was able to get more done at work. She didn't have any cravings to use Kratom. And then we transitioned her from Suboxone. Again, that's buprenorphine and naloxone, the sublingual form, over to the long-acting injectable buprenorphine, and the form I used for her was Sublocade. Interestingly, she just came in to see me last week and had a relapse on Kratom despite being on Sublocade. So she was not in opiate withdrawal, but was having some breakthrough cravings. And what had happened is her psychiatrist had stopped her Strattera for various reasons. So she was feeling unfocused again. And that she really didn't have anything as needed for cravings. So I just put her on a little baby dose of sublingual buprenorphine. I gave her the Subutex formulation, and then she's going to see her psychiatrist about managing her ADHD. So she might still be a good candidate for the atomoxetine, but given the fact that she's also having some depressive symptoms, we may want to put her on some bupropion, also known as Wellbutrin. So that's really an overview of what I'm seeing. And as you heard, a lot of what I do is understanding mental health and trying to support people with their mental health in addition to the traditional MAT medications for addiction. We must understand how trauma affects our patients. And I know you all know that. I'm still fairly new to this. I'm getting very interested in the work of Dr. Gabor Mate. In his words, everyone with addiction is traumatized, whether that's small traumas like bullying as a child or the more severe traumas like personal violence, assault, sexual assault. We really have to co-manage PTSD because many of our patients are just trying to numb themselves. And I know that's an oversimplification, but literally yesterday, my first patient of the day, years and years of sexual assault in the foster care system. And she said exactly, and I quote, "I drink alcohol to numb my feelings." So we have to address PTSD. As I mentioned, Kratom is a developing public health issue. The industry is changing and making more and more potent products. Kratom is actually a leaf, but you can dry it and then put it in a capsule so you can consume more. You can also chemically treat the leaf and extract the chemicals so you can get even more. And they're actually even starting to really modify the leaf and make some synthetic and semi-synthetic versions of the chemicals in Kratom, almost like coca leaf got turned into crack cocaine. We're seeing the same thing in the Kratom industry. So we are going to see more and more Kratom as it's unregulated, and these extracts and synthetics are extremely potent. I was always taught in the ER that ADHD is kind of a minor issue, defer it to outpatient psychiatry, but really co-managing ADHD is important in treating addiction. If you can imagine, you can't focus on your schoolwork. Because you have ADHD, it's very hard to focus on the recovery work. So I am now very aggressive in treating unmanaged ADHD in patients. I use a lot of the non-addictive ADHD medications. And then the last thing is buprenorphine. A lot of our patients don't like to be dependent on anything. I get countless people asking me, when am I done with buprenorphine? The data would suggest that when people come off of buprenorphine, when they're stable for opioid use disorder, within about 18 months, 2/3 will relapse, get back on buprenorphine, or have an overdose. So as we heard in the third case, being fairly liberal with small amounts of as needed for breakthrough cravings can be very helpful. And if someone does want to come off their buprenorphine, it's a lot of regular contact to make sure that they know what to do if they're craving. And then again, for a lot of my patients, I just give them like maybe a few doses of buprenorphine a week that they can take when they are craving. So for this patient, we're going to keep her on Sublocade for several months and then use it to wean her off of buprenorphine. And then I'll still keep her on just a few doses of buprenorphine a week as needed. Thank you for taking the time to learn about addiction. It's a fight we cannot win without awareness and action. There's still so much we can do to improve how addiction is treated. Together, we can make it happen. Thanks for listening. And remember, treating addiction saves lives.
Thanks for listening to episode 70 of Trip Report. On today's episode, I am joined by Libby, one of the hosts of the Kratom Addiction podcast. Libby reached out to me on Instagram, saying that she had listened to the episode about Colin's struggles with Kratom and how she herself had kicked a pretty aggressive Kratom addiction with Ibogaine. I immediately listened to episode 87 of the Kratom Addiction podcast, which featured her story. Okay, so you said that prior to having the issue with Kratom, you had a past with heroin.
Yes. I have a long history of addiction issues. I've been off of heroin since 2011, so it's been a really long time, but yes, I definitely had a heroin addiction at some point and had heard about Ibogaine in that context back during that period.
What do you think would be the best way to educate people to basically just convey, listen, if you have had any issue with addiction to anything in the past, even if it's cigarettes, like, this is probably not a good thing for you. Do you think there's any way to convey that message?
I'm so passionate about it that I became a host on the Kratom Sobriety podcast. So
that's one way to do it.
I want to get the message across to people that like it should just come with a grain of salt. You should just know what you're getting into. And it's about education. I think that there needs to be regulation. I think that it's really heartbreaking when you hear these stories of people that saw these little blue bottles, the Kava Kratom concoctions. They're literally at 7-Eleven and they're just like, oh, they're literally there at the checkout. And you're like, oh, what's this? And they're like, the guy behind the counter, it's just a it's an energy thing and it's an herbal tonic and they're just selling it to you. And then you start taking them and lo and behold, you find out 4 months later that these things are poisonous and they're very addictive and you can't stop and you're getting sick and it's just heartbreaking. So I think that these things need to be regulated. There's also all these, like, we all know the dangers of smoking cigarettes. We all know the dangers of drinking alcohol. They just need to be educating the public because it's a lie. This marketing that's going on is a lie. I sometimes get targeted by ads on like Instagram, TikTok for other off-brand Kratom kava drinks. And like, I have to click the link and look through the ingredient list to see what it is because they'll put it on, which is the active compound in Kratom. They don't even put Kratom on the label. Like they're literally trying to deceive you. And it's just heartbreaking because these are humans and real lives that they're affecting. I've heard of a bunch of stories of people that aren't even addicts getting hooked on this stuff.
What I do love is that you did a lot of research on it before you went in. You said you went down Reddit rabbit holes, finding everything you could about it.
Yes, I listened to every podcast that had ibogaine in the title as well as iboga. Yours was a definite top of the list, so thank you for that. Yes, there was the ibogaine subreddit. I ended up getting a hold of the moderator, and she basically told me, like, any of the big ticket places that are like lots of marketing, lots of money that seem to be like the big ones you would gravitate towards, those should be the ones that cause you to think harder about whether or not they're in it for the right reason.
What I do like about the place that you went to is you said they did do an EKG before and blood work prior.
That was required, absolutely. They did not want me to get down to Mexico and find out I had a bad EKG and then have to send me home. And I did a full blood work panel, liver enzymes, all the things.
You make the decision, you fly into Mexico, you arrive. Tell me how you're feeling inside. Are you nervous about this?
Oh, yeah.
Yeah.
For sure. So nervous. I mean, it was like a 12-hour journey down to Mexico from Los Angeles. So yeah, I got there like the middle of the night, been using Kratom all day, and I was definitely nervous. But you have 3 days to integrate. It's better to do like a step down, like a tier system to get people off of opiates instead of just giving them it's very intense to do a blood dose. Some people call it inhumane. They step you down and down. So every time I took ibogaine, I would go without morphine for 6 hours. Morphine is like a very clean, fast acting. So by the time that's been metabolized, then they give you your dose and you're usually in withdrawal and you start to feel better and you go into the experience a little bit. And then when you come out, they restabilize you on usually half as much morphine. So by the end of the stay, there's not much left to get through. I would say today, as good as I could be, I would say 95% bettering myself, but I'm doing fantastic. Yeah, thank you so much, Sean. I really appreciate it.
This is Addiction Medicine Journal Club. I'm Dr. Sonia Del Tredici.
And I'm Dr. John Keenan.
We believe that addiction is a disease that can be treated. For this episode, we're going to be discussing more articles that changed our practice in this past year. Ready for our last case?
A 28-year-old male with a history of opioid use disorder and methamphetamine use disorder presents to the clinic with concerns about a potential relapse. The patient was previously treated successfully with depot buprenorphine 100 milligrams monthly for 25 months and chose to discontinue treatment and taper off the medication 18 months ago. Over the past 12 months, he has been using increasing amounts of a gas station compound called Kratom to help with mood and energy. Although he's unable to specify a precise quantity, he spends anywhere between $80 to $120 a day on the compound. While he has not used illicit drugs like opioids or methamphetamine, he experiences withdrawal symptoms whenever he tries to stop taking Kratom and resumes use. The patient is frustrated, concerned, and seeking guidance on how to stop using this compound. And I'll be honest, this initially started with like a crossover episode for us. I was like, what is Kratom? It was kind of my initial thought. And when this patient actually came to me, that's exactly what I thought. It's like, I don't know what to do with this. I'm going to have to do some reading. And then I read this article is a case series called Long-Term Buprenorphine Treatment from Kratom Use Disorder, a case series, and it's from Substance Abuse in 2022. So the clinical question was, can buprenorphine naloxone effectively treat Kratom use disorder? And so methods, this was a case series of 28 adults with Kratom use disorder treated with buprenorphine. And I'm going to start by saying Kratom use disorder isn't a disorder yet in the DSM. So I'm just going to say that it's a tentative diagnosis or exploratory diagnosis.
It better be soon because it's not a DSM disorder, but dang, is it a problem?
It's going to be there, right? And you know, I actually love this case series because it was just a bunch of like people that do like what I do, kind of giving their it was almost like I was just sitting around having coffee, talking about what we're doing with this unique situation. So I really like that. So data included Kratom use history, buprenorphine dosing, urine drug screen results, and treatment duration. Patients, the average age was 36. Average daily Kratom dose was 92 grams. Buprenorphine dose, you know, people were treated with this very successfully. Most stabilized on 12 to 16 milligrams per day. Very similar to my patients I'm treating primarily for opioid use disorder. 71.4% continued treatment with a treatment duration of 5 to 22 months in these case series. So that's a pretty good rate. 82% had negative urine drug screen testing results for mitragine, which is the byproduct compound that we use to test for Kratom by 12 weeks. 32% restarted Kratom use during treatment, most within 6 weeks. So kind of a relatively high relapse. I mean, it took a lot of like inference from this, but certainly a potential treatment option for an emerging disorder that we're seeing more of. I think that the other thing I take into account here is this treatment course pattern, dosage, timing, relapse rate. It seems very similar to our patients primarily treated for opioid use disorder. So kind of phrasing it in that lens really kind of lets me kind of understand the disease and process a little bit better. And I will tell you, I think we've talked about this a couple of times. I've gotten curbside by a lot of people since we did that episode about people, family members, friends, some previously very high functioning that have developed an issue with this product. And were surprised that I knew anything about it. So revisiting this case, I would counsel this patient that while, you know, first of all, there's no FDA approved treatment options for problematic Kratom use. There's no formal DSM diagnosis for Kratom use disorder. You know, I would personally recognize this as kind of a relapse of opioid use disorder and kind of treat it accordingly, offering them off-label buprenorphine to treat the Kratom use component and see if that would help mitigate their signs and symptoms of withdrawal. And certainly the few patients I've had with us to date, it's actually worked very successfully.
Yeah, I've treated a bunch of patients with the buprenorphine for Kratom use disorder. It's worked really well, but a lot of them aren't comfortable being on buprenorphine. They feel very kind of embarrassed, and they're people who didn't have other substance use disorders, and they kind of feel like they've ended up in this situation that they quote unquote don't belong in or don't want to be in, suddenly having to receive addiction treatment for this product that they purchased over the counter. So it's kind of a sad situation for a lot of people. I just was going to say, I'm glad you're there to help, you know?
Yeah, I mean, we didn't cover this article for our top 8, but we did do the other article where you covered like demographics for this group, and, you know, very high rate of opioid use disorder kind of in recovery participants. So I haven't had people with like that didn't have that history to date yet. Not saying I'm not going to encounter that, but certainly there is a lot of overlap in the disorders is what we're seeing.
Yeah, just a tiny side note. I have one person in my practice who was using Kratom in the context and service of an eating disorder, anorexia. And then I had looked into that and came across a few more cases of people suffering from eating disorder and then getting connected to, Kratom and becoming addicted to that as a component of the eating disorder because of the stimulant effect. And this patient had no history of any substance use disorder. So
interesting.
It's very interesting. And that sums up our 8 articles for 2025 that we thought changed our practice the most. Thank you for presenting these, John.
Yeah. Well, thank you for listening to the Addiction Medicine Journal Club. Thank you for being part of the conversation, and have a great day.
I'm Jason Ellis. Today is a different kind of show. I have talked about my sobriety several times, not too much detail. Somebody brought up, Jace, have you tried Kratom? And Michael and I have had Kratom on the show. We talked about it. We had a producer that talked about the scary parts of how dangerous Kratom was, and Tully and myself made fun of him for years. So I got into them, and I did them. My wife and I did them all the time. And then it got to the point where they weren't sending us boxes of it in time. So we were going to the liquor store and buying them, not by the bottle, by the box.
Always by the case.
Yeah, save money, right?
Yeah.
We would buy the case. And this is from our local liquor store where he didn't give me a discount, dude.
This is probably a good time to introduce our guest.
Yeah.
Hello, Noah.
Hello.
Joseph Urbina? Did your parents always call you by both names?
Of course, when they were mad. Just the class. Just Noah. Just Joseph is my middle name. I want to give a little bit of backstory leading up to what turned into this Kratom addiction, because for years I took it without any issues whatsoever. Not only that, advocated for its legality when it came under scrutiny from the FDA because of A Leaf of Faith, the Chris Bell documentary, that he was purporting it to be some sort of a miracle sort of a thing. And at the time, I was consuming just a tablespoon here and there. I never exceeded that dose. And it was just like a nice little mood booster. If you just take a spoonful of the ground up leaf powder, I never had any issues with it. I would share it with friends. I did come under, like I said, FDA scrutiny. I advocated for it to be legal, but to look back on it, internet was different than it even is now. But so from 2016 to 2020, I would buy a kilogram off the internet and it would last me for 6 months, 8 months. Easy peasy. Come 2020, we all know what happened in 2020. Everything just got very weird. And between COVID, in the sense that there was now this weird just energy in the culture, we were separate from people, we weren't allowed to do shit, and there was just a lot of frustration and resentment in the culture. For me being a lifelong addict, but imagining that I was through all that, I was living in Sonoma, California, up north, and I went down to my produce stand where I would just get fruits and vegetables, and they had this little bottle called Feel Free. 2020 is when it came out. And I'm like, oh, look, there's a little thing that I could get and not have to mix it myself. It's just so ready to go. And much like the first time I did a lot of drugs, for me, it was the very first time I drank it. I'm just like, I do that now. I do that. That's my thing.
Can I ask what sort of issues you'd had with other drugs in the past?
So alcohol was never my thing. The first time I smoked weed, I realized that I could just feel this way forever. And so it was that all the time. It was, opiates, Adderall, amphetamines, certainly meth, like anything I could get my hands on at any given time, given that between 18 and 30, I wasn't making much money. So whatever I could get my hands on, I would, just to not feel sober.
Yeah, and I think it's a common thread for a lot of addicts.
For sure. And that's what's hard about Kratom generally, is that for it to be categorized by the CEO of it as, sugar and caffeine can also be addictive. And so it has the potential for addiction, but so do sugar and caffeine. It's a little disingenuous to me because at no point are people having to go through extreme acute withdrawals from caffeine and sugar and have to go to rehab and all of that. It's categorized as a wellness tonic, a safe alternative to alcohol, a social lubricant, and all of those things that lead people to believe that it is safe, but also I'm in multiple groups now of people that are trying to come off it and all that, and half of the people in there are addicts, and it was just like this next thing to find. The other half of people never drank, never did drugs, never wanted any of that, but do like to go out with their friends, and they ended up as addicted to any junkie, anybody, anywhere, anytime, no history of drug abuse, anything like that. They just wanted to go out and have a nice time with their friends, and it, especially in its early stages, it does work as a social lubricant, and it does work to tolerate your drunken friends a little bit more, and you get out there and you become a chatterbox. And for me, initially, like, I could work 18-hour days as long as I kept a steady stream of that shit in me. But just like any drug, first you use it to get high, then you fall, and then you use it to get well, and then you use it to just not feel awful all of the time. And this is exactly that. So from 2020 to 2021, I was steadily taking it, and within about 6 months started losing weight, not being social anymore, got super pale, just gnarly, looked awful. Then went another 6 months and taking 8 to 10 a day, sometimes more. Had to have one on my nightstand because I would wake up in the middle of the night in complete withdrawals. Had to drink one in the middle of the night just to go back to sleep. Had to drink one the moment that I got up in the morning to not feel like you're going to die. If I didn't have one in the morning, I would go down to the produce stand and I would get there 15 minutes early in hopes that they would open early because I was just tweaking out in withdrawals. And what sucks about all of this is that I'm no fool when it comes to drugs. Like I know about them. I've done them. I do my research. I know about things. And something about that gradual process, it wasn't obvious to me what was happening at the time. And I would show up at 5:45 to get it. And I was in a little town and it was only available there or about a half hour away. And guess who would be there at that time in the morning? A couple other junkies. Like we're meeting in a back alley to get a fucking bunk heroin deal. And if nobody was there, I would buy all that they had. If someone else was there, like we would get together, be like, do you want to split that? And you want to split that case?
Wow.
And they only have one. And we would talk about it and maybe that other person didn't realize how severely addicted they were to that thing. But it was, to look back, a little bit funny to see some other skinny, tweaked out kind of dude, which, I mean, at the time, like I was a pillar of my community at the time. So the fucking shame involved in that kind of behavior was atrocious. All common drugs of abuse. At this point in our culture, everybody knows what's to expect if you start taking too many pills, too many opiates, too much heroin, too much cocaine, too much alcohol. There's a common known cultural understanding of if you do this, we all know the end result of this. This is so new. Kratom is so new that not only is it not understood, but as Jason experienced, that like talking about it on the internet, I mean, people will just rip you to shreds. And I see it for two reasons. A, they don't know. B, they're hooked and they don't want somebody talking about the thing that might get some sort of regulation, which means they won't be able to get their drug. And so given that it came in under the banner of being less of a concern, an herbal supplement for the drink, a wellness tonic, even if you can drink it and notice that something more severe is happening, whether it's the junkie mindset or not, there is a part of you that doesn't think that what's happening is that bad. And then it's a frog in boiling water situation where you go from having one a day, or my initial one was 1 in the morning, 1 in the afternoon, and you're good.
Yeah, like a coffee.
Yeah, but just the body adapts to anything. So to go from 2 to 3 doesn't seem like that big a deal. To go from 3 to 4 doesn't seem like that big a deal. And there are things that your body does on a subconscious level that some of these are not conscious decisions made a lot of the time, that as the stuff leaves your body and the discomfort starts to set in, and to remedy that, all you have to do is spend another $10 on a thing. And it's just a herbal remedy down at the store that it just happens so gradually that one day you end up in a position. And for me, it was the very first time that I took it to go to sleep. That's when you know you're in the upside down. So to take it in the morning, get you jazzed up for the day, take it in the afternoon for that afternoon lull, then I get it. And in the evening, sure. But the first time I had one at 11 o'clock at night, because I knew that I wasn't going to sleep unless I got this feeling out of my body, at that point, I'm like, I think I'm in a real bad place. And guess what? Just kept on going. And
how long would you say it was from then until you actually...
It probably took 6 or 7 months to end up at the point where I had to take it to go to sleep, and it went on another year after that.
I see.
More worse feelings. I probably spent about $60,000-$70,000 on them. 10 a day. Let's say it's $100 a day, 3,000.
Wow.
Oh, it was more than that. They were actually closer to 12 early on at the time. So let's say $3,600 a month, 40+ thousand.
You didn't want to get a promo code?
Yeah, you should have used mine. I would have been rich.
Yeah.
I remember doing 4 a day and talking to somebody about it, and he was like, I do 6.
Yeah.
And I didn't feel good about 4 a day. I could already tell that was not healthy. But when he said he did 6, here's the thing, like I feel like some people, it's if we were here talking about how everybody should not drink, it's poison. I mean, there is facts to that, but some people like a drink on the weekend and get at a wedding or whatever it is, and they work and they do their jobs and they're great people and there's no harm, no foul. Can there be a way of doing Kratom in a way where it could be, like, I don't know about beneficial, but not ruin your life? Yeah, of course.
Yeah, I wanted us to make sure we talked about that too, to give somewhat of a reasonable acknowledgement that some people don't have problems with it.
Right. I feel.
Well, and I'm sorry to interrupt. And I think you have to say that because you lose credibility when you tell people, no, if you do this, it's going to kill you. And then there's people going, well, that's not my experience. Well, then everything else that you're saying loses its credibility.
Yeah, you're 100% right.
But it's also, there's like people that are got off painkillers and I use Kratom and that's helping me. So fuck you. Because that was the thing when I talked about it on social media. People came at me with that one. And I was like, look, I get it. And my thing is like, the more I get sober, there was a time there where I smoked weed every day and I would skate and there would be people that would be around me that would go, dude, I don't know how you can skate. And then I quit and was older and more honest with who I really am. But I had to go through all these things. I had to work on my sobriety. I did like steps and had a sponsor and was very, like, I stripped myself down and was very honest with what I really am. Like how, because also if I tell myself like, would I be a better parent if I didn't smoke weed? Well, then I won't be able to smoke any weed. So I'm not going to tell myself that. And I could argue, I was pretty good at it, where I could convince you I'm actually more playful. You know what I mean? I'm funny when I'm high. And I was like, yeah, I've got myself convinced of that. Kratom is 10 times gnarlier than weed. 10 times. And I got knocked out skating a bunch of times because I had to do a shot to skate. And I'm in my 50s and I'm like, I'll just do one feel free before I skate because I don't want to get too woozy. And now, looking back, I'm like, oh my God, dude.
I want to talk about what withdrawals were like, because it's something that I've been talking about for a long time, and I think it's really important that people know about it. And so leading up to going through white-knuckling withdrawals with nothing to help, which I went on a 2-week-long vacation. I had weaned and tapered leading up to then, looking like that meme of Charlie from Sunny in Philadelphia down in the mailroom with the fucking red strings going. I had been scrawling my tapering schedule on my mirror every day just to try to wean down to make going cold turkey tolerable. And so the first day we were there, I tried to go on a hike. I intentionally left all remaining, but I left it in the car, walked 3 hours away from the car, and 3 hours was about how long it took for me to enter withdrawals, and now I'm 3 hours away from the car, absolutely fucked. Going into withdrawals, can't fucking walk, can't speak, can't do anything. But on day 11, that night, I slept for about 2 hours. The next night, I probably got 6 hours, and the road to recovery happened. It started from there. It was probably 6 months until I felt like a regular human again, but like on that stuff, I mean, you get styes in your eyes, liver issues, heart issues, kidney issues, your skin starts fucking sloughing off of your body, it turns gray, and like I have an entire list of symptoms I would like to read at some point, which are common throughout all of this, but yeah, it took me a full 2 weeks of not just withdrawals, but severe and acute, where you can't do anything, you're just a waste of space, and all I could do was just lie there, stand there, rock back and forth, tremble. I did make a couple videos that are available to be seen, whether on my Instagram or YouTube, and I encourage people.
What's your YouTube?
I mean, there's maybe 3 videos up there. They're on my Instagram, and that's Urbeezy, URBEEZY, that people, because I put the entire 10 or 12 minute videos up there, but also made some short ones that are a little bit more concise about it. And then since then, once you go through something like that, it almost shifts your destiny in life outside of your own choosing, where if I went through that and I now know enough about it and want to know about it, it became, in my opinion, my responsibility to talk about it as openly as possible. And then if I can get out in the world and talk to people, and whether it's help anybody through it, remind them how severe this is, offer them some words of comfort while they're going through that experience, like it shifted what my role in life was. Like, I work with dogs, I'll probably always do that. I do sports things always, but like this now shifted into, well, getting sober, even though I use the term non-reliant. I feel like just the word sober has a lot of baggage with it, but that it became now a part of my life to talk about it and see if there's anybody that I can help through this process. Because something you brought up, Jason, it is so fucking shameful and embarrassing, addiction generally. But this stuff in particular has a different sort of feeling that comes with it because it masquerades as a fucking wellness tonic, and people are so embarrassed to say that they got addicted to gas station heroin. Well, there's something there's more to not knowing about Kratom culturally that's happening right now, is that when people end up in that position where they have to go to rehab for it, doctors, nurses, a very small percentage of them know how to deal with it. There is not a standard protocol for how to get to take somebody through with their withdrawal experience. And another thing I've made a long list of is all the things that I've talked about people using to get through their withdrawals. But even people whose job it is to get people through withdrawals or get them through a detox, they don't know how to treat it. And primarily it's being treated like opiate withdrawals. So yeah, Suboxone, naltrexone, a bunch, like even just sedatives, benzodiazepines can help. Then you're flirting with a potential other addiction, but it is not entirely known, because it's too new of a cultural addiction, how to deal with somebody in that state. And some of the people in the groups I'm in have said that they're addicted to other things just so they could get a different treatment plan, because they were laughed at when they said, I mean, maybe not literally, but not taken seriously, to say that they got addicted to Kratom. And so that's a bad part of it too, to not know how to deal with somebody who's going through a very severe experience because there isn't a protocol for it.
So what about resources?
So there's the WhatsApp group that I'm in, that if anybody feels like this resonates with them, it's called the Feel Free Sobriety Group. I'm an admin in there, and you do have to be let in. There's the Reddit thread called Quitting Feel Free, a Reddit thread called Quitting Kratom. On Facebook, Kratom Danger Awareness is one. Also, Quitting Kratom Support. And then the Kratom Sobriety podcast is just people telling their story. Like, it's going to be a slog at some points if you're at a high dose, but there are some ways to reduce the severity of the experience. And those are, if you have access to any of those, can just help. But being seen and understood by people is really helpful, because it's really alienating to get hooked on a wellness product masquerading as some sort of wellness drink or a safe alternative to alcohol. Is extra shame.
Yeah.
Yep.
Agreed.
Yep.
Thanks for doing the show, Noah.
Yeah, man.
Appreciate it.
My pleasure.